Hello, we are live. Hello, hi. If you hear me, please just wave or say yes, you hear me. Hi, everyone. Happy Wednesday from freezing cold Toronto. Dr. Amin here. Good to have you all. Hi, that's good. Thank you. Very well. So today we're going to talk all about heart cardiovascular disease in women. Postmenopause is still the leading cause of death, so I think this is an important talk today. I was very excited myself to talk to Dr. Suzanne Steinbaum, our cardiologist expert. As usual, I just remind you, this is not medical advice, just educating everyone and hopefully empower you to go and talk to your doctor if you have any symptoms or worries. If you had any questions, you can drop it in the comment or question box, and we try to go through those questions. It's all about heart disease. Hi from Azerbaijan. Good to see you today. Okay, so let me just go and invite Dr. Suzanne. Hello, hi. Lovely to meet you and have you here today.
So nice being with you. Thanks so much for having me.
Absolutely pleasure.
It is freezing here in New York City today.
Wow, yeah, same here in Toronto.
It is cold, but I love talking about my favorite topic. It warms my heart
It
to
warms my heart too.
be able to share all of this amazing information. And you've been out there educating women, and I just love that we can do this together today.
It's amazing. It's great. So we can't wait. First, if you don't mind to introduce yourself to everyone here, and then we start the talk.
Sure. My name is Dr. Suzanne Steinbaum. I am a cardiologist, and I have a specialty in prevention and women's heart health. I am in private practice in New York City, and I am the CEO and founder of Adesso, which is a software.
Oops.
There we are. Sorry.
That's okay. We'll have you back.
As I was saying, I'm the founder and CEO of Adesso, which is an app for women's cardiovascular prevention, health, and wellness.
Very good. Interesting.
It's been a long career, and my purpose is really to teach women all about how to prevent heart disease. Women get heart disease and die of heart disease more than men, and 1 in 3 women will die of heart disease more than all cancers combined. And so much of this is about education, it's about self-empowerment, and it's about self-advocacy, because this story has to change. These statistics have to change.
Absolutely. You're totally right. So why? First of all, the main question, why is it? Why women are at risk of cardiovascular disease after menopause?
What's so interesting is that before menopause, this estrogen that starts decreasing in the body is one of the most protective things for us. It keeps the arteries healthy, the lining of the arteries healthy. And as estrogen decreases, the lining becomes really stiff. And that's the first stage of heart disease. But the other thing that happens is really the change in our metabolic and our biomarkers that really increase the incidence of heart disease. As we decrease estrogen, our cholesterol goes up, and in fact, our LDL, our really bad cholesterol, increases. We have an increase in belly fat, and that in itself increases the risk, but it also changes how we metabolize sugars, and our metabolism of sugar decreases. We become insulin resistant. So now we have also, with those stiff arteries, high blood pressure, the potential of high cholesterol, the potential of high sugars, increased belly fat. And this is really the setup for heart disease. And that's why our risk goes up after menopause.
Yeah. So it's all about estrogen and, as you mentioned, insulin. And I think another thing that I notice in me is more stress. It's the age that we're more stressed. Work,
Well,
family.
we've got a lot going on, right? We have our jobs, many of us have kids, we have our family, our parents, and we are juggling everything.
Mhm.
It is extremely challenging to try to balance it. And so we don't balance, we juggle. And that juggling act is incredibly challenging. And that stress that happens leads to another issue, which is difficulty sleeping. So now we have stress and we're not recovering. And all of these stress hormones lead to, it's epinephrine, norepinephrine, lead to an increase in heart rate. It increases the clamping down of the arteries, so the blood pressure goes up, and we have an increase in inflammation. And that inflammation causes incredible amounts of trouble to the lining of the arteries and can be part of what causes plaque formation.
Mhm. And on top of that, women start, a lot of women have hot flashes, which again affect the sleep. So have hot flashes and sleep problem. So what about hot flashes? Again, that is which we see a decline in
It
estrogen.
It's so interesting because
Mhm,
we always have thought of hot flashes as being this separate issue that is associated with a decrease in estrogen, and that's it. But what's so interesting to know about hot flashes is the more intense and the more frequent you have hot flashes, the greater your risk of cardiovascular
mhm,
disease. So paying attention to that becomes
mhm,
so important, because if they are often and frequent, you have to talk to your doctor knowing that your risk increases. There's a correlation between those stiff arteries and hot flashes. One of the things that we do know is one of the best ways to treat those hot flashes, let's put hormone replacement aside for a second,
mhm,
is really exercise. And exercise in itself helps to treat those stiff arteries, helps them to dilate. And because of that, it has a secondary effect on those hot flashes and can improve them. And it actually can improve your sleep. So when you think about going through menopause, put exercise as the top of your list of things to do.
mhm. Yes, yes, yes. So you're all about prevention, which I love. I love prevention. But before we get there, I want to see, so we know, so as you mentioned, the risk is higher in women. The risk of death is even more than men after menopause from cardiovascular disease. And so now, what are the symptoms that women have to start looking for? And what is the time? When is it to get worried about those symptoms or red flags?
Well, let's just say that the symptoms in women are oftentimes more subtle than men.
Mhm,
Men, we think of an elephant sitting on the chest. That's what we typically talk about. But for women, it can be much more subtle. It's things like chest discomfort, but also it could be shortness of breath, jaw pain, back pain, nausea, vomiting, even flu like symptoms
mhm,
can really be how heart disease prevents. Here's a very startling statistic, though. We think of heart disease happening only after menopause, but that's not the case. There's actually an
mhm.
increased rate of heart attacks in women less than 55 years old.
Yes,
So now
scary.
we really have to start paying attention to our hearts early.
Mhm.
And as you mentioned, prevention is critical. So knowing your risk factors, knowing your blood pressure, your cholesterol, your sugars, talk to your family, knowing your family history, understanding your stress, and all of the things that go into your risk of heart disease that aren't those typical risk factors, like if you've had adverse outcomes of pregnancy, like preeclampsia or gestational
Mhm.
diabetes. If you have an autoimmune disease, your risk goes up. So, calculating all of this out, knowing your risk is so important because if you have any of those subtle symptoms of heart disease at any stage in life, it's really important to talk to your doctor.
Yes. So all those risk factors. On top of that, then our environmental toxins, the people who smoke, drinking alcohol, in excess, and poor nutrition or wrong processed food. So all of those are very much increase the risks and metabolic dysfunction, of course.
When you think about our environment and our lifestyle choices, it's really the most critical thing for us to think about. Some of them we can change, like
Mhm.
what food we put in our mouth, but other things we can't change, like how that food is grown. You know, it's really hard. The toxins that we are dealing with are real, but we can make some choices about how we nourish ourselves that can have a huge impact on our overall health.
So as you mentioned, it's a little bit tricky, those symptoms which are compared to men different. It's not like severe chest pain, crushing chest pain. So what when they have women start feeling indigestion or a little bit of chest pain, what should they do?
If that pain gets worse and is getting more intense or happening more frequently
Mhm.
and it's not going away, you've got to go to the emergency room
Mhm.
and really be looked at as soon as possible. If it's something that's happening infrequently or it's rare, then pay attention to it and go see your doctor. What we know is that when the blockages in the arteries are significant, these symptoms often get worse with exertion, with exercise. And so, if you're doing your normal things that you do every single day and they become harder, more difficult, or these symptoms occur, that's really, really important to know. And that's when you have to talk to your doctor. But if those symptoms get worse, go to the emergency room, just get checked because time is muscle. And we know that the sooner you get there, the more we can protect your heart.
Absolutely. So we talked about some of the symptoms and some of the risk factors. So exercise you mentioned is one of the ways prevent and help yourself. What are else? What are the normal things you recommend as a preventive factor and step?
So the first thing that we just talked about is really knowing your risk factors, and
Mhm.
that becomes critically important for prevention. You have to know what your risk is, and you have to know where intervention needs to happen. Is it that your blood pressure is high? Is it that your cholesterol is high? Where is the issue? But we always start with the basics, and those basics are exercise, which is recommended by the American Heart Association to be 150 minutes per week, say 30 minutes 5 days a week. Strength training is really
Mhm.
important. Stretching is really important. And then it's really your nourishment, how you eat. Your diet is critical. Food is medicine. And so I always recommend a Mediterranean
Mhm.
diet, actually staying away from those saturated fats, but really focusing on the good fats, the omega-3 fatty acids, like things that are found in fish and avocado and olive oil and
Mhm.
nuts, multigrains, vegetables. Just think about anything you would eat on the beaches of Greece or Italy. That's really the kind of diet that I recommend. But then we have to look at the other piece, stress management. Is it going to be meditation? Is it going to be a breathing or mindfulness? But there has to be something in your day that you do on a routine and regular way to manage your stress. paying attention to sleep, going to bed early enough that you can put yourself to bed the same way
Mhm.
you would put your child to bed. You've got to think about it the same way for yourself. But prevention then becomes, do you need medication? What supplements do you need to supplement what you might not be getting? And addressing these issues very objectively become important. One of the things I've often heard from patients is, I don't want medication. And I always say, nobody wants medication. And sometimes things are out of our control, and medication can be life-saving. For example, if somebody who has a really strong family history of high blood pressure and they've been controlling it with diet and exercise, and now they're perimenopausal and their blood pressure goes up, it might be time to say, I'm going to start medication. There's only so much you can do. And it's not your fault if you can't do it on your own. And just understand that sometimes medication can be life-saving.
Especially that, so you mentioned about blood pressure. So what is the complication of not treating that blood pressure, elevated high blood pressure for a long time? So that maybe sometimes people not know or not aware of long-standing not treating that high blood
I
pressure.
think this is such an important
Mhm.
question because we think of high blood pressure as the silent killer. You can go for a really long time and not treat it. But what's happening inside is so destructive. It can lead to stroke, it can lead to heart disease, it can lead to kidney failure,
Mhm.
it can lead to dementia. And so when we think about one of the easiest things we could do to prevent dementia, prevent stroke, prevent heart attacks, prevent kidney disease, sometimes you need to take medication. So please don't let high blood pressure go for a long time. It's so detrimental to your health.
It is. Yeah, very important. So, someone is asking a question for you. Is there research going on to see if estradiol and micronized progesterone have the same inflammatory effect on platelets, foam cells, macrophage, and matrix metalloproteinase? So it's a little bit a specialist question. One of our doctors is
As
asking this question.
one of the doctors, I'm
Yes.
so relieved it's a
Yes,
doctor. I was saying, my
yes,
goodness,
yes.
everyone is so educated.
Yeah.
I think one of the most interesting things that happened recently is that a huge amount of money in the United States has been put into research for women's
Yeah.
health. There are so many questions that we don't have the answers to yet. And the basic question of the true effects of estradiol replacement on the coronary arteries, the inflammatory markers, we are not
Mm.
100% sure yet. I hope we're getting there. And as I say, the dollars are now there for the research. And now we have to just give it a little bit more time until we know the facts around it.
Exactly. So we know estrogen or estradiol, which our body makes, has anti-inflammatory effects in our body, but still, I think we have to work on see if we have the exogenous the
That's
estradiol that we have in our hormone therapy, menopause hormone therapy, if that has the same effects, prevention of heart disease in women.
We know that what it does do is help to dilate the arteries. And the question is often when, for how long, in what
Mm.
form transdermal estradiol is safe in patients who have cardiovascular disease. And so we know that it does help dilate the arteries and
Mhm.
can prevent cardiovascular disease within those first 10 years postmenopausal. One of the things I think is so important for women to understand as they go through that perimenopausal to menopausal transition is not to wait too long till that all the hormones are gone. Getting supplementation during that process so you don't lose all your hormones and then supplement them can really help protect those arteries during that transition.
Mhm. So, how to diagnose? What are the tests, available tests? Is it the same as for men? and diagnosis easy, or is it different? Should they ask for, or women have to ask for different tests?
Much of the research I've been doing in my career is around this.
Mhm.
What do we test and how do we test? And it's really important to understand that most of the testing is really diagnosing heart disease in men. It looks for problems in one location of the arteries, and in women, we often have disease diffusely throughout the arteries. So, classical testing, like a stress test, can miss disease in women. So the other issue is that microvascular disease is the most common form of disease that we see through the perimenopausal and early menopause period. It's the smaller arteries that are affected. And those smaller arteries can cause symptoms, and treatment is important. But to your point, how do we diagnose it?
Exactly.
It can be diagnosed invasively, which is not what I would recommend. Cardiac MRIs can diagnose it, but it's not as accessible to get that, and it's a very expensive test. What I recommend is using a cardiopulmonary exercise test that can actually determine not only VO2 max, which is a marker that you might have heard of that really talks about our cardiac vitality, but can also show us how well the arteries are dilating and if there's microvascular disease. But one of the other tests that can determine about disease besides stress testing is a visual image, a CAT scan angiogram that uses AI called Clearly, can look for soft plaque that's diffuse in the arteries instead of just looking at disease in one location. But it goes back to what are your risks?
Exactly.
And if you are at a are at a high risk of disease, you are going to want your testing to be more aggressive than if you are just looking to see what your risks are, where a stress test might be satisfactory and just enough.
Yeah, so if, for example, a woman who's 50 with strong family history of cardiovascular disease, maybe psoriasis, which is an autoimmune disease on top of that, or an ex-smoker, definitely is all high risk, and elevated lipids. So these are all adding to your risks, and
That's right.
maybe you want to have more of tests
That,
rather than someone who is lower risk.
that's exactly right. Through Adesso, and I would say go
Mhm.
to our website, adesso.health,
Definitely.
because this is where we talk about the different testing and we talk about the use of cardiopulmonary exercise test as a functional and physiologic way to really understand a woman's cardiovascular risk. And we also talk about imaging and how putting those two things together can be the most sensitive way to understand and really know not only what your risk is, but what your diagnosis is and what your treatment should be. When we look at how to treat a woman, we don't just look at one aspect. We look at, is she postmenopausal? Does she have high cholesterol? Does she have high blood pressure? Is there a family history? Is there evidence of plaque in the artery? What is her VO2 max? And all of these things together can then give us an understanding what medication is beneficial. Is hormone replacement therapy something that's indicated? But if we don't look at all of the pieces together, we're not really going to get a holistic understanding. Prevention needs to be personalized. And that personalization really is about the individual and her genetics and her lifestyle choices and all of that objective data
Yes.
that goes into making those decisions.
Someone is asking about blood tests. What type of blood tests or what is important to check as part of the diagnostic tests?
It's very important to get your cholesterol checked, but not just the basic cholesterol, LDL, HDL, triglycerides. I also recommend apolipoprotein B, which really tells us the particles that are going to lead to plaque formation. It's a more sensitive marker, especially for women. The other is LP little a. It looks like LP with an A in parentheses, lipoprotein little a. It's a genetic marker, and it is associated with early plaque formation. It is something that you get from your mother, father, and it increases your risk of cardiovascular disease. So if you have an LP little a that's high and an LDL that's high, you are somebody who might need to be on a statin, a cholesterol lowering medication, earlier than someone else. The other test I would recommend is a hemoglobin A1C, which looks at your sugars over a 3-month period of time. An HSCRP, an inflammatory marker that really understands your inflammatory risk. And this gives us a big picture. Another marker I would like to suggest is an ApoE, which tells us genetically how we process fats. And we know that people who have an ApoE that's 3,4 or 4,4 is associated with an increased risk of cardiovascular disease and is actually also associated with Alzheimer's. And the last thing I would suggest is a thyroid panel. Being hypothyroid can be associated with high cholesterol. So treating that might be the underlying issue. And then really putting that together can help you understand what your true risks are of heart disease.
Very good. Very interesting. Someone is asking about eye exam. What about eye exam?
When
Is
you
that
do an
part of?
eye
Mhm.
when we do an eye exam, it's so interesting because you can actually see the vessels. And when you see the vessels in the eye, you can really kind of determine whether there's high blood pressure or potentially the risk of cardiovascular disease. We say the eyes are the window to the soul. I say they're the window to the heart. They're really an easy way for us to say whether or not that blood pressure is actually having an impact. And if you see that in the eye, it's very worth going for a heart test, checking blood pressure, and looking to see if there's cardiovascular disease.
Mhm. Very interesting. Dermoid ovarian cyst, can it increase the risk in 20s or 30s? Someone who has dermoid cyst. I don't think so. Probably polycystic ovarian syndrome. That again, people normally suffer with lots of hormone imbalances and insulin resistance, which increases definitely the risk. I'm not sure about dermoid ovarian cyst, any relations with cardiovascular
I'm
disease.
not aware of dermoid cyst in and of itself causing an issue, but like you mentioned,
Mhm.
polycystic ovarian disease is a metabolic issue.
Yes.
And so it's a very different kind of problem that often leads to problems with fertility.
Mhm.
But as you mentioned, it also can lead to insulin resistance and high blood pressure, high triglycerides, all of which eventually is a risk factor for heart disease.
Yes. And nowadays we see, I mean, I had a patient, a very healthy woman with no whatsoever risk factors in her 40s and who had a heart attack. And after so many different tests we did, we realized that she has sleep apnea. So I don't know any mentions about sleep apnea in your practice or any recommendations. We see more and more people suffering this condition.
I'm really glad you bring that up because sleep apnea is not only associated with heart disease in terms of heart attacks, it's also associated with high blood pressure and obesity and atrial fibrillation. And it's often neglected and not diagnosed. And so, one of the questions that we do ask is tell us about your sleep. Are you sleepy during the day? Do you snore? one of the things that we always talk about is if you're sitting doing your normal things, do you feel like you're going to fall asleep? And if the answer is yes, it's oftentimes because you're not getting restorative sleep at night, and sleep apnea might be one of the critical reasons why. What's so interesting is, again, we always thought of this as a man's problem with a large neck who's obese, and that's not necessarily the case.
Mhm.
And so asking those questions to every single woman is really important and a huge risk factor for heart disease.
And smoking and alcohol, those two, we not see as many people as maybe 30 years ago, but still, this is a major problem in this day and age.
It's interesting because many years ago, smoking was the huge topic.
Mhm.
And now we're talking about sitting as being the new smoking because we're assuming that everyone got the message about smoking. I don't even talk about it anymore because I just am like, it's a non conversation. Don't smoke.
I
That's
know.
it. But now we're talking about how everyone is sitting, and being sedentary in
Mhm.
itself is such an increased risk of heart disease, and it increases the risk of insulin resistance and of high blood pressure. And here we're now such a sedentary society, sitting here talking like this and being on our computers all day and sitting in our cars, and really being aware of this is such a huge part of how to prevent heart disease. Getting up, and exercising for like 2 minutes every hour,
Yeah.
sitting back down can be life changing
Mhm.
and incredibly important. And that's separate from the exercise that we're talking about.
Mhm. Which you mentioned, it is recommended 150 minutes a week
Yes,
minimum.
minimum.
And then, so you mentioned strengthening is good. Strengthening, and what about cardio or any type?
Cardio, cardio should be 30 minutes, 5 days a week.
Hmm.
And really, it's getting your heart rate up to a moderate intensity heart rate zone. Back in the day, we used to think that you had to exercise until you felt like you were going to pass out. That is not necessary. It's really in this moderate intensity zone where you feel like you're a little short of breath, but you can easily finish a sentence. It's just hard like that, just to get the words out. And that's really how you should be exercising. And again, it's 30 minutes is your sweet spot, and at least 5 days a week. By the American Heart Association, strength training should be at least 2 days a week.
Hmm.
And that's really your major muscle groups. Um, Getting your muscles activated can really increase mitochondria, and those mitochondria help support our cardiovascular system and help really support us when we're doing cardiovascular activity. So there is such a synergy between both cardio and strength training. And of course, strength training is so important for our bones as we go through menopause to prevent osteoporosis.
Absolutely. So many benefits.
So many benefits.
So
And
many.
it makes us feel good, increases serotonin.
Yes.
It's sort of a little happy drug.
Mhm.
So it's really helpful for sleep as well. So many benefits. For me, exercise is the best medication.
Even it helps with hot flashes, ladies.
Yes.
So don't miss a day without exercise.
Get sweaty on your own terms, not through hot flashes.
Yes. What about, so, and a very, very common question I all the time patients ask me is about supplements, how to supplements, what is good, especially for heart and cholesterol, people who have especially high cholesterol. Any recommendations on supplements for cardiovascular health?
Yeah. The one thing I want to say about supplements for high cholesterol, we got to go back to the risk factors because I don't want people to think that taking a supplement for high cholesterol is the right thing to
Mm,
do.
mm,
You have to really understand if that high cholesterol is putting a risk on your heart. And if that's the case, then you should be on a medication and not just taking a supplement. But when I think about the best supplements for your heart, I think about omega 3s. You can actually get, I didn't mention that in the blood testing. You can get your blood tested for an omega 3. And if your levels are low, I would recommend an omega 3 supplement. Coenzyme Q10, we talked about mitochondria, could be very supportive if you are on a statin, especially. Magnesium can be incredibly helpful for preventing extra beats, which palpitations can often happen during menopause. So that is really important. Vitamin D also. If you are deficient in vitamin D, I would recommend a supplement. And then there's some others that are interesting that are there, such as NAC, which can really be a potent antioxidant. And I do recommend that for people who have chronic inflammation as being a supplement, as well as an omega 3. And those are the general supplements that I would consider and recommend. There are a lot of information and data out there that supplements are not for everyone. I don't really like how those studies were queried. I'm talking about levels and checking levels and supplementing based on blood testing. I don't recommend you take high doses of omega 3s because you might not need it and it might not be necessary for you. So getting tested can be really part of how I recommend supplements
I
to be
always
taken.
say test it and not guess.
Ah,
Not guess
there,
it.
there you
Test
go.
it.
We're on the same page. Yeah.
So one last question about risk. So we keep talking about risk, calculating those risk factors. Is there, you mentioned about your app. Is there an app? Is there something for public to go and do a little bit of calculation even without or before seeing the doctor and calculate the risks
Yes.
as far as they
So
know, they're aware of?
here's what's interesting. The standard risk analysis misses women's risk about 50% of the time for women less than 65 years old. So using the standard risk analysis you're going to get in a doctor's office is actually not going to be helpful for you. And that's really what we're doing in Adesso. We do have the Adesso Heart Score. It is on our app. And we are in the Apple Store and Google Store at My Adesso. So you can look for us there. There is more information on adesso.health about your risk analysis and really how to talk to your doctor. So if you don't have access to a risk score, know what your risks are. You might not be able to get that score in the same way, but understand, do you have family history? Do you have adverse outcomes of pregnancy? Any inflammatory diseases? Talk about your depression. Talk about anxiety or PTSD and really understand when you go to the doctor, you have to advocate for yourself. I hate to say it. Your doctor's trying, but I'm sorry, in today's day and age, your doctor doesn't have all the answers, but I hope you will. And you will by just being here, by getting educated, by finding the responsible information out there that you can become your own self advocate when you do go to your doctor to tell your risk.
Amazing. And someone is saying how passionate you are and they're going to recommend you. Absolutely. I agree with that.
Thank you. I want to tell you one last thing.
Sure.
This is the takeaway. 80% of the time heart disease is preventable. And it really starts with knowing yourself. I always say just live from the heart. And living from the heart really means taking control of your lifestyle, understanding who you are and what you need to become the best version of yourself. And that means with starting by knowing what your cardiovascular risk is. Because if you take care of your heart, you are taking care of yourself from head to toe. And it starts with you.
Yes. 80%. That's a huge number. And we can
80%.
prevent. That's good to know.
It's everything. It's the most empowering thing I can
Yes.
share with you today.
Yes. It was lovely talking to you. And hopefully
Wonderful.
I meet you in person
I will.
I met you. You were a speaker at Dr. Wanda Wright's a couple of months
Yes,
ago.
yes. I'm so happy to be with you today, and I look forward to connecting with you again. Thank you so much
Wow,
for
thank
having
you.
me.
It was a lovely talk. Thanks. And thank you to everyone who's been here.
Thank you. Be well.
Bye-bye.
Bye.